Hello, everybody, and welcome to the show. This episode is brought to you by The Wellness Paradigm, a holistic health coaching company shifting the way that women understand and heal their bodies. Through bioenergetic testing, functional lab testing, and functional nutrition, we uncover what traditional approaches often overlook so you can stop guessing, start healing, and finally feel like yourself again. No more one size fits all approaches, just real answers, deep rooted healing, and the clarity and confidence you deserve to feel incredible. It's time to shift the paradigm of women's health. Now, on to our show. Hello, Amber.
Hi, Shannon. Thanks for having me.
Yes, I am really excited. This conversation is going to be really enlightening for so many people. She is a biologic dental hygienist. So we are going to talk about so many just fun things that really don't get talked about enough. She's also a holistic health practitioner, and she really specializes in uncovering the root causes of oral health issues and helping patients restore balance from the inside out. What I think is really cool of what you do is she bridges the gap between dentistry and whole body wellness through like functional lab testing, personal protocols, and education so that patients can really become, own advocates for their own health. So it's going to be really interesting, and I'm so excited to dive in. So I will let you tell them a little bit more about yourself and how you got into this work.
Yeah, absolutely. I really appreciate you having me. I'm excited for the conversation.
Yeah.
Yeah, so I got into this so I worked as a traditional dental hygienist for a few years, and I would say pretty early on, I realized that there was something missing in how I was treating my patients.
Yeah.
Um, you know, People were coming back with the same problems. We were kind of giving the same treatment to everybody, regardless of their actual health status. And so for me, that really led me to diving deeper and starting looking more into nutrition. But then I actually stumbled upon holistic dentistry and I kind of never looked back. I got a job in a biological dental practice startup, and I started managing that practice, working with clients, and just seeing the transformation in people's health was the game changer for me. It was everything I had been looking for, and I didn't even really know it existed at the time.
Yeah, holistic dentistry. I know that's something that maybe you can just elaborate a little bit more on because I know it's new to even me just from a few years ago. And so can you talk a little bit about maybe the differences between traditional dentistry and more, holistic?
Yeah, of course. Yeah. So I got involved in it probably about 7 years ago now, maybe eight. And so, really, the big difference is, everyone in the dental profession is trained traditionally. We learn our clinical skills, the human anatomy, physiology, all of the things. But holistic or biological dentistry takes it a step further. So, it's really how everything that's happening in the mouth impacts the rest of the body and vice versa, and how we establish balance in the systems of the body to self regulate and heal.
I think I remember talking to somebody about holistic dentistry and they're like, "Oh, Shannon," they're like, "That sounds like quackery," and it's like, "No, this is so important." I mean, and something I know I personally do, like I do bioresonance work, right? I can literally see the tooth and different pathways that it's impacting and make it more like in the 3D for people because what's happening in your mouth affects everything. I mean, and I'll let you elaborate on that a little bit, but why I feel like there aren't that many people that are doing it. I feel like that's kind of one of the biggest roadblocks. Would you say that that's correct?
Yeah, I mean, it's definitely still a growing field. I would say there are holistic and biological dentists in most states now in the United States. But it's definitely something that's evolving, and more dentists are getting on board with because they're seeing what's happening with their patients. Our health has shifted, right? The paradigm has shifted. Our patients are wanting to look further into their health. The patients are actually seeking this out. When I speak to dentists that are practicing traditional dentistry, they're telling me patients are coming to them with questions about nutrition, questions about the products that are being placed in their mouth. The patients are seeking this out, which is making the dentist do some investigation and make that transition. So that's a big thing that's happening is being an
Hmm.
advocate for yourself is so powerful because you can actually shift, this landscape of dentistry and medicine in our country.
Interesting. So I'd love for you to explore a little more when we say teeth are connected with the rest of the body. What does that really mean?
Yeah, so it's a big topic, but just an energetic standpoint, right? Our teeth are energetically connected to different organ systems of our body.
Mhm.
And something that's going to display that is the tooth organ meridian chart, which is rooted in Chinese medicine and acupuncture. And so we can actually see that our teeth are connected to our organ systems and vice versa. So sometimes we can see an issue with an organ system of the body, and we can actually correlate it to something that's going on with a tooth.
Mhm.
Um, and there's a lot of things that we can do. Thermography is a tool that we can see that energetic relationship. A cone beam x-ray in a dental office is a 3D image, the jaw, teeth, bone, nerve pathways, sinuses, airway, all of that. And so traditional x-rays are two-dimensional, so we're getting a flat image of what's happening inside your mouth. With this cone beam, it's three-dimensional, so we can see things that don't appear visually on a 2D x-ray. And that's something I've seen a lot in practice is, someone is symptomatic or they're having multiple health issues, and we can actually get this cone beam and see that maybe there's an infection or different things going on around the tooth that would otherwise be missed.
I've had a lot of clients over the years, and it's so interesting when they get something like a root canal, suddenly their autoimmune issues flare up. And they go to their doctor, and their doctor's like, no, it has nothing to do with that. It's like, but that's the only thing in my life that changed? And then suddenly their teeth are decaying in other ways, and suddenly it's like, wait, I have to get another root canal. And then suddenly their body starts shutting down. And I'm sure you've seen people like this, and we're dismissed because no, it cannot be that. You know what I mean? Can you talk a little bit about maybe things like tooth decay or root canals?
Yeah, absolutely. So root canals are definitely a more controversial topic, right, in dentistry. But there's some facts that we know. We know that there's no such thing as a 100% sterile root canal.
Mm.
And so when a root canal is performed, we're removing the life supply. So the blood, the nerves, um, and our teeth are self-cleansing. And without that life supply, they're unable to do so. So we know that we're not able to clean out all of the accessory canals that live with inside the tooth. And then we also know that that's a place that is now stagnant and it's not able to self-cleanse. So it's an area that bacteria can build up. And that's why root canals tend to become reinfected for a lot of people. That being said, there are instances where a root canal might be the best option. Say a child, a trauma to a tooth, their jaw's not fully developed. So there's a lot of different factors to take into consideration. But when you mention like autoimmune disease, if the body is in a chronic state of inflammation, a chronic flare, a state of imbalance, doing something like a root canal might not be the best option for you because your body is not able to heal effectively. If our hormones are imbalanced, our cortisol is imbalanced, we have delayed healing, we have suboptimal healing. So it's really, and that's the thing with biological dentistry, it's really taking in all of the factors of your health and individualizing your care.
Which is just mind blowing to me because I'm sure people listening have never even heard that this was an option. We've gotten more used to holistic health practitioners, people like, you and I that like run the labs, all that stuff, but not in the dentistry world. We don't really make those correlations and how important they are, you know? What are some of maybe the top things that you see in your practice with what people come in with, maybe with their teeth, but what it might correlate to on a deeper level?
Yeah, so I mean, I see definitely a lot of things. I see patients come to me for a number of different reasons, whether they have bleeding gums, they have recession, they have jaw pain, they're having frequent cavities, bad breath, all the things that we think about when we think of our oral health. But what I like to do is correlate that to their symptoms because what is your energy like? What does your mineral status look like? Our teeth are composed of minerals. Our saliva is reliant on minerals to remineralize our tooth structure. I look at things like our tongue posture, how our tongue sits in our mouth. How are we breathing? Are we breathing through our nose or our mouth? So there's just so many things, and it's really bringing all the pieces together. I also look at the oral microbiome, and that's just a big fancy word for the bacteria in our mouth, right? And so we want a state of balance or homeostasis between those bacteria because we have some really beneficial bacteria, and then we also have more pathogenic bacteria. But we don't want to wipe everything out because then we have imbalance and we can have more of a disease process. We can deplete our nitric oxide, which is responsible for our circulation. So there's a lot of different things, and it's really all connected.
Ah, so cool. I feel like I'm getting called to ask this question, and maybe it's controversial.
Sure.
The whole fluoride versus no fluoride versus nanohydroxy versus, that whole debate. I think it can be individual, right? But I would be so curious on your thoughts on this.
Yeah, so I have a lot of thoughts on this. And my first thought is fluoride is a neurotoxin. And how are we introducing it to the body? There's two big ways that we're getting fluoride. And there's some other ways, but the two main ways that we're getting it is through fluoridated water supply, which is systemic. There are no studies on the efficacy of systemic fluoride. And
Mhm.
topical, which is what you'd have in a dental office or what you'd have in a toothpaste, and that's applying it to the tooth structure. Now, the big thing with that is it has the ability to initially harden the tooth structure. um, but over time and chronic exposure, it actually weakens the tooth and your bones over time. So, my biggest problem with fluoride is in the water supply because we're not regulating the dose and we're mass medicating a population and we're getting fluoride from other sources. So at the time when water was fluoridated, we didn't have all the products that we have now that contain fluoride. Fluoride does naturally exist in some foods and some teas. A lot of my clients and just a lot of people in general are on medications. And, one medication in particular, SSRIs, typically have fluoride. So we're getting fluoride from all these different places and we're getting it at an excess level. And
Mm.
that's been linked to lower IQ. It's been linked to skeletal fluorosis, meaning weakening of our bones. And so for me, the water supply is the biggest concern. And I think there's better options. We rely so heavily on toothpaste and the right products, but in reality, if our body is in balance, our teeth have a natural remineralization process. If we have the right minerals in our saliva to do so, if we have a more neutral pH of our mouth rather than acidic. So I would rather work on those specific things, balancing our minerals, getting our pH out of that acid level, and working on supporting the body and healing versus just really placing the major emphasis on a product.
Yeah, I think that is important. I right now, where at least at the time of this recording, there's some big shifts potentially happening with taking fluoride out of the water, which is exciting. But yeah, I think you're right. Not I think, I know you're right. Especially with minerals, we talk about minerals so often. I know in the way we used to do things, we ran a hair tissue mineral analysis for all of our clients when they first came in. Now we do a little bit more, bioresonance work, but we still can do HTMAs. Do you guys do HTMAs or do you do HTMAs?
I do run HTMAs on a lot of my clients
Yeah.
because so much of what they're dealing with is
Kind of a
imbalance.
lot. Well, I mean, I think many clients have very similar patterns, but I think you would probably agree a common pattern we see on HTMAs is just those top four just being depleted. Just
Yep.
depletion, chronic stress overload. Everybody's overloaded with stress, and when that literally naturally depletes your minerals. And so I feel like everything always comes down to chronic stress and absorption, which both go hand in hand. But, how would you in your field, I'd be so interested to hear when you have a consult with somebody with an HTMA, how you're addressing it. Yeah, what would you kind of talk about?
Yeah, so definitely there are the minerals that are really important for our oral health. So looking at those initial four, the calcium, phosphorus, sodium, potassium, magnesium, these are all really important. A lot of times we'll see calcium on an HTMA, which is really elevated.
Mhm,
And that's letting me know that the calcium is not being directed where it needs to go. And
mhm,
so we need these coenzymes, co-nutrients like vitamin D3, K2, and magnesium to drive the calcium into the bone and the teeth. And so
mhm,
that's a big thing. That also contributes to heavier plaque and tartar buildup on our teeth. So I'm
mm,
looking really, into that. I'm also looking at their stress response because an imbalanced nervous system cannot heal. And so if you are having dental work, if you're having, oral surgery, I want to know what your nervous system looks like. I want to know your thyroid function. I want to
mhm.
know your adrenal function as well. So I'm really trying to connect all the dots on that test and how we can support your healing. Also, really looking at what is in the mouth because there's so many different products and things that are placed in our mouth, whether it be fillings that contain mercury or BPA or other endocrine disruptors. And so, really knowing what's happening in the body and how they're detoxing. Also, looking at the heavy metals on there is really important too.
Oh, well, especially for, I mean, well, we're always seeing that, but a lot of times people don't take into account their teeth when they look at heavy metals. I mean, I've seen practitioners who don't even ask if they have any,
Yeah.
mercury fillings, any, gold, whatever in their teeth. So I think a good question is, what are the most common things you see on an HTMA elevated besides calcium? And if somebody is coming in, I'm guessing many people probably come in with mercury fillings, gold fillings, silver fillings, whatever that looks like. How are you kind of guiding them into maybe educating them a little bit on maybe the dangers of that? If there's hesitation, maybe there's not hesitation if they're coming to you, but hesitation on maybe removing and replacing, and what would you replace it with? I'm sorry, that was a really loaded question.
Yeah, so definitely looking at the heavy metals, of course, mercury is on there. We know that amalgam fillings, which are those darker fillings that we see in our teeth, they contain about 50% elemental mercury.
Mhm.
And so we know that there's no safe place for mercury to exist, especially not in our body.
Yep.
And especially not in our mouth, which is highly vascularized and is absorbing everything we put inside almost
Mhm.
immediately. What we know about those fillings is that the two greatest exposures are when they're placed, which many people have had these in their mouth since they were, 10, 12, 14 years old, and also when they're removed. We want to make sure they're removed safely with a biological dentist. They follow something called the SMART protocol, which is a safe mercury amalgam removal technique.
Mm.
And that is a very specific barrier system supplement protocol to help detoxify. And they're really treating the tooth in isolation and not exposing you to the mercury vapor. We
Mm.
also know that just on a day-to-day basis, those fillings release low levels of mercury vapor through clenching and grinding our teeth, chewing our food, chewing gum, drinking something hot or cold in temperature. So we know they're slowly off-gassing. And so we
Mm.
really want to support the body's detoxification pathways and make sure their drainage pathways are open before even considering something like removing them from your body.
Oh, oh, I'm so happy you just said that. Drainage pathways, detox pathways, they are not talked about enough. We talk about detox a lot, but you can't detox when your drainage pathways are really clogged, So chef's kiss. Yes, because I mean, especially people can have negative reactions when they think they're doing the right thing. And, their body just goes into inflammation overload, you know what I mean? Trying to detox and almost having, like a herx. How would you guide somebody on, somebody listening maybe has no idea what drainage pathways is? Um, are there steps to opening those up before maybe they come to you or when they come to you, and then what that next step would kind of look like?
Yeah, so I ask a lot of questions. I want to know all of the details. There's no such thing as TMI as far as I'm concerned when it comes to your health. And so we want to make sure you're sweating. We want to make sure you're going to the bathroom
Mhm,
regularly. We want to make sure your liver and kidney function is good. We
mhm,
want to make sure you're actually breathing. Our lungs are a huge part. Moving
mhm,
the lymphatic system is a huge part. And so really understanding what's happening and how we can support that. I speak to a lot of people who are like, I don't know the last time I sweat. Well, if
Yeah.
we're not sweating, you know, things are recirculating in our body. If we're not actually going to the bathroom, and the amount of people with gut dysbiosis and bloating and constipation, if you're not going to the bathroom, all of this mercury vapor is recirculating into your system. And mercury has an affinity for tissues, it has an affinity for our thyroid, it has an affinity for our brain. It's going to store somewhere once it's removed from your teeth, and that's going to be in your body if we're not able to excrete it in the way that we need to.
Ladies, if you are listening, bathroom regularly means 1 to 3 times a day, not a week. So if you think, oh, I'm pretty regular because I've gone, every other day for my whole life. No, 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 no. Definitely that's one of the first places to look because if not, yeah, I mean, you excrete toxins through stool, sweat, pee,
Mhm.
things like that. So I love that you said that. Outside of mercury, I mean, gosh, I've seen thyroid is an epidemic. I feel like right now is just the amount of thyroid issues, and I know I've worked personally with many clients where we've made them feel so much better, but there's like that one thing, and it's like we've done all that we can do, but if you still have something like a root canal or mercury, that might be the missing piece. Those are big things we see. That and breast implants are a whole nother topic, but something in your body that's foreign and doesn't like out, and then they see symptoms resolve, and that's like that one little piece that's like, okay, that was now our body's like, oh, thank you, I can heal,
Yeah.
with other kind of things that you see often in the mouth, besides the obvious like tooth decay, cavities. Is there something specific that people come to you for that's maybe a little less known or obvious, maybe?
Say that sometimes it's really the symptoms, and but they know something is off in their mouth. They might not necessarily even know what it is, but
Mm-hmm.
we all have, right? Our bodies have this innate ability to heal themselves, but we also have an innate wisdom. And so you will know something is wrong with your body before any test, before any lab, before anything. And so it's almost like this inner knowing that something is off. And so I work with a lot of clients, and they might not necessarily say like, "Oh, I'm getting cavities all the time," but they have fatigue, their digestion is off. You know, I have clients that come to me a lot because their hygiene is impeccable. They're brushing, they're flossing, they're using all the cleanest products. Their nutrition is great. Their gums are still bleeding, right? They still have gum disease. And most of the time, it ends up being hormonal
Mm-hmm.
because our hormones are so connected. Our gum tissue is a metabolic tissue, so it responds to our hormones, and so that's just a big part. A lot of people will come to me because they're having different things going on in their mouth, and they really want like a roadmap, of how to work with a dentist because either they've been kind of pushed aside, they've been shamed, they have fear and anxiety. So yeah, I feel like there's a lot of different ways people will come to me, but it's really about connecting the dots and being a partner in their health journey with them.
Love that partner in their health journey. Need more of those. I feel like a lot of women, I mean, people in general, but yeah, we're dismissed. And I feel like it's not necessarily that traditional dentists mean to do that. It's that their scope is only going to go so far, right? Same with normal doctors and why maybe like someone would work with me or you. It's like there's only so much that they can connect the dots for you, unless we're medicating or trying, take out a tooth or whatever it looks like. What do you feel like are kind of some of the most overlooked aspects to having a strong oral microbiome?
Yeah, and I just want to just highlight, I don't think anyone is intentionally trying to do harm to their
Oh,
patients. That's one of the topics that I feel like I'm never bashing traditional dentistry. Like everyone is practicing traditional dentistry with the addition of the education and tools that
mhm.
they are bringing into it. Um, but there's so much that really is important for our oral microbiome. We need to know what is in our mouth. We need to know how we're able to detoxify. So, I know you mentioned thyroid disorder, and there are so many triggers in our mouth for thyroid disease, for autoimmune disease. And we know, right, the statistics say it's like 90 to 95% of hypothyroid patients are Hashimoto's. So we know there's an
Wow.
autoimmune variant. And so, some things in our mouth that can trigger autoimmune disease are gum disease. So, if your gums are bleeding, that's never normal and that's never healthy. And a
Mm-mm.
lot of times we just ignore that symptom altogether. I talked about mercury fillings, but there's also tooth colored fillings that do contain BPA. We
Mm.
know that's an endocrine disruptor. Things like root canals, cavitations, which is another whole big topic to address. But really knowing what's happening inside your mouth and the bacteria profile. If we have chronic stress in our mouth, like we think of stress as our body's response. But if we have an interference field, and these things that I'm mentioning are interference fields affecting our body, it's this chronic stress, this chronic low-grade inflammation. We're not able to detox estrogen effectively. We're not able to regulate cortisol. So we just see so much imbalance. The mouth has to be a piece of the puzzle when you're working on your health. It's just, it's so often overlooked, and it's just really knowing what's going on. There's so many different practices we can do to enhance our oral microbiome. We want to, but it's so deep and it's so nuanced, and everyone's plan is individualized. But we want to remove the toxic products from our home care. There is a
Mhm.
list of ingredients we don't want to see.
Mhm.
We don't want the fluoride, we don't want the triglycerin, we don't want the sodium lauryl sulfate, we don't want the dyes, the plastics. We want to take those out. We want to
Mhm.
remove any products that say kills 99.9% of bacteria because we want balance. We don't want to wipe out all the bacteria in our mouth. Some of them are really beneficial, and that's what keeps our mouth healthy. We can incorporate different things. If we're dealing with someone that has gut imbalances, we can talk about things like oral probiotics and
Mhm.
addressing low stomach acid because we know low stomach acid has such an impact on the mouth. Yeah, there's just so many different things that we can do to heal. I mean, of course, I love the tools like red light therapy. Red light therapy is amazing for oral health, for us, our saliva production,
Mm.
for reducing inflammation. So there's just so many things we can do.
Ooh, literally as somebody, I like have my red light like right over there. I love my loom box. But like I didn't think about it for saliva production. How
Yeah.
interesting. I mean, I understand from an inflammatory perspective, but I'm not really using my red light in all honesty and thinking my gums are really loving this. Um, so interesting. So red light, obviously, we can dabble with probiotics in some regard. Are there any other things that are really helpful, especially if maybe somebody's just trying to get started with addressing all this?
Yeah, trying to get started. First thing I'd incorporate for everyone today, tomorrow, a tongue scraper.
Oh
Uh,
yeah.
it is one of the most beneficial things for our mouth. We harbor so much bacteria on our tongue. It
Mhm.
also is a practice that stimulates our digestion. And I think a lot of people don't realize that our digestion starts in our mouth.
Yes.
We have these enzymes, our carbohydrate digestion starts in our mouth. So, if we're not starting that digestive process effectively here, we're going to have trouble with digestion in our gut. So,
Mm.
the tongue scraper I would add right away. Think about what, my specific concern is dentally. If I was someone that was frequently getting cavities, I would incorporate something that's remineralizing, like a nanohydroxyapatite toothpaste to my routine. If I was someone that was more prone to gum disease and inflammation, I'd introduce a product that contained vitamin C, CoQ10, prebiotics, probiotics to reduce inflammation. Vitamin C is one of the other best tools for our oral health because our gum tissue is made of about 70% collagen. Our jawbone is about 90% collagen. And of course, we know we lose collagen as we age. Vitamin C is the precursor and will stimulate your body to produce its own collagen. So, if we have bleeding gums, we have inflammation, we definitely want to introduce some vitamin C to our routine. I prefer a liposomal or a whole food form of vitamin C, but those are just some quick, easy things you can add right away.
Yeah, also vitamin C is great for the adrenals, so
Yep.
all
Yep.
y'all probably. Probably need it. When I put vitamin C on people's plan, they're like, I don't get sick. And I'm like, well, that's also another thing with like your immune system being way too heightened. But that's besides the point. It's not just for your immunity, it's for your gum health too, or not gum health. I speak more for adrenals, but that's really interesting about the gum health too. Recently in our intake form, we started adding more questions about oral health. And that's mainly because, with the bioscans, we'll see, teeth signatures come up and we can kind of connect the dots a little bit quicker. But, I'm like, man, 10 years ago, I really should have been adding this into our, intake form too. If any practitioners are listening, it's very important. So the toothpaste, there was something else, the C, what was the other thing you mentioned?
Scraper.
Tongue scraper. Oh, yes. Is there a specific kind that you like or don't advise like to get?
I would recommend a stainless steel or copper tongue scraper. Yeah.
I've got a couple.
You get them really inexpensively
Mm-hmm.
places. So we can tag a link or something if we want to.
Yes, I know. I think I got my copper on Amazon. It was like a few bucks. So, is there a certain amount of, ooh, this is a question before we wrap up, I just thought of. Is
Sure.
there a certain amount of time that you should be replacing it? And also, I know I'm guilty, but I have an electric toothbrush and sometimes I'll alternate between a regular one. How often should you really be changing the heads of that? Because the bacteria on it, I feel like
Yeah.
relates every time.
The standard has been every 3 months for a long time.
Hmm.
But that's really just a general kind of standard. You want to look at how you're brushing. If the bristles tend to look like they're splayed out, we definitely want to change it sooner. If you happen to get sick, you want to change it out immediately
Mm.
because that bacteria is there. I actually started using an electric toothbrush that has a UV case. So it's going to sanitize the bristles because there's so much bacteria sitting on a toothbrush, especially if we're not rinsing it really effectively when we're done brushing. Um,
Mm.
so at least every 3 months, probably sooner for a lot of people.
Guilty of not doing that. But it is important. It's like you look at your toothbrush and I'm sure you see like there's like crap all around it, and that's like bacteria. Like that's growing. So everyone's gonna go and I feel like I need to have an affiliate link for like what's the big toothbrush brands? Whatever.
Yeah, there's a Sonicare or
Sonicare, there you go.
Fury, which is the one that has that UV case. It's a newer one out, but yeah, at least seasonally, right? Change it with the seasons. It will make you remember.
That's a good way of thinking about it. I love it. Is there anything else that you want to share, something that you see that you feel like is really necessary, especially for somebody that's maybe kind of new to this world?
Yeah, I think that one of the things that you're going to see a lot more information about and probably have a lot of questions yourself about is breathing and how important that is for our oral health. And we are in this time where jaws are not developing properly.
Mhm.
And we see mouth breathing as a very common occurrence among the population. And mouth breathing, not only does it not allow our jaw to develop fully if we're doing it from a young age,
Mm.
it also makes us more prone to cavities, gum disease, other oral health issues. And obviously, it dysregulates our nervous system because we're not breathing effectively and getting into that parasympathetic state. So I think you're going to see a lot more information on your tongue posture, how it sits in the mouth, how we're breathing, and that's all connected to our oral health. And I think a lot of
Mm.
times we think it's a separate entity, and it's really all connected.
How interesting. I mean, that makes complete sense, especially I feel like a big thing right now is like mouth taping, right? And taping your mouth shut at night. And But to see that correlation between oral health is really interesting. I know more from a nervous system perspective, but I didn't really think about, I guess, my my oral health being affected by that as well. Um, cool. Well, thank you so much for sharing your insights. I feel like this was incredibly insightful. If somebody wanted to find you, connect with you, please let us know where.
Yeah, I am on Instagram at naturallyamberwhite, and then my website is naturallyamberwhite.com.
And I
Pretty
think you're in Rhode Island, right?
I am in Rhode Island. I do see clients mostly virtually, but in Rhode Island, I do see clients at Solitude Wellness Center.
Cool. So she's got both. So if you're in Rhode Island, awesome. But if not, you can still connect with her. And thank you again for coming on. If you guys found this helpful, I would love for you to leave a review. Just let us know, like, if this was insightful for you, or simply DM us as well if you have a question. Feel free to message her or me. We love to hear just when things resonate. And thank you again, Amber, for your time. And we'll see you on the next show.
Thank you so much.